Hello, everybody. Welcome back to the Mermaid Vet Podcast. I'm your host, the practice manager, Tim Hopson.
And I'm Dr. Peter Mosites.
And today we will be speaking all things diet. Just a quick background. Tomorrow is Thanksgiving. And if you haven't already, please take a moment to go back and listen to our Thanksgiving episode that covers all things that the dogs should not be given, all kinds of food that you shouldn't be feeding your pets on Thanksgiving. And if you notice my voice is a little off today, we've got the flu or the cold going around, despite the fact that it doesn't get cold here in Florida. But my whole family is going through the cold right now. And as you can see, Dr. Mosites also has his hands full. So today's a little out of the ordinary.
So for those of you just listening to the podcast and not watching us on YouTube, I've got my youngest, the reason why I've been filming from this location for the last couple months. We welcomed him in September, and he is just 9 weeks old today, I think. 9 weeks old Friday.
So, as I said, today we're going to be talking about diet. Some of the things we hope to accomplish today. By the end of this, we want pet owners to know how to choose the right diet for your pets, how to avoid common risk, and also save money without compromising your pet's health. So let's start it out, Dr. Mosites. Why is nutrition important? Why does it matter?
Nutrition is important for the same reason it's important for us. And even more so for dogs, I should say. What you put into your body matters. What you put into your dog's body matters. We talk about all the different things that can happen to a dog's body. So we talk about diseases like cancer. We talk about diseases of the intestinal tract, of the kidneys, of the heart. All of those things are what really gets big headlines. But probably the most common thing that we see in clinic is obesity. Overweight dogs and dogs getting poor nutrition are going to have joint problems. They're going to potentially have organ problems as well. They're going to get dental disease. They're potentially going to get GI upset. Diet creates a lot of issues that could otherwise be avoided pretty easily.
Absolutely. What all conditions would we be worried about when we're watching nutrition? What things could be affected?
So we'd be looking for weight. There's some diets that potentially could cause heart disease or speed up the process of it. There's diets that are going to be too high or too low in certain nutrients that could cause issues. Having a really high protein diet, even though it sounds good, can sometimes cause a little more stress to them. So for certain pets, it may not be the right answer. And then we're going to see GI issues, skin coat issues. And then in extreme cases, if we're really getting something that's lacking a nutrient, then we're going to see deficiency issues. So, vitamin A deficiency, things like that.
So then what would you consider to be the perfect diet?
So, there is no perfect diet. There is the best diet for your pet, just the same way I keep saying stuff for humans. I don't know if it's true or not. I'm going to say there is no perfect diet for a human. There is. It's Taco Bell. We've talked about this before.
Yes, absolutely. Everyone knows.
It's not, my doctor doesn't agree, but what does he know? So there is no perfect diet for a human either, but there's the perfect diet for an individual. And that's what we're shooting for here. We're going to give guidelines for how to pick an appropriate diet for your pet.
So let's talk about the different categories that we have of the food, right? There's several. We've got things like a dry kibble, canned wet food, raw diets, and a few others. How about I mention a topic and you go through each one of them a little bit? How about dry kibble? What are some pros and cons?
All right. So pros for dry kibble. Something that's going to come up later that's going to be important is it's homogeneous. So every piece of kibble has the same nutrients pretty much as every other piece of kibble. So when your dog's eating it, they're getting all the nutrients all at once. Kibble is affordable. It's shelf stable. It can be stored for long periods of time. So basically what kibble does is it makes adequate nutrition available to the masses in an easy to administer, easy to store way. So without kibble, it would be a lot tougher to get a lot of dogs their nutrients. Some of the cons would be that it can have spoilage. So despite the shelf stability of it, if you don't store it correctly, especially here in Florida with the humidity that we have, you can have mycotoxins, so mold that grows on it and cause illness in your dog. And then the second one is going to be the perception of it, really. So the idea that you somehow cook all of the nutrients out of the food, which isn't really how that works. And then the real one, though, would be that there are poor quality kibbles out there. That's something we've had more of a problem with historically. So I think before the 80s, but still can be a problem today. Same thing for all diets, right? So you want to look at the guaranteed analysis to see what's actually in the food. You want to look at the moisture content. You want to look at the calorie content. And depending on your inclination, you can look at the sources of food as well.
Okay, so we had a little bit of editing session there. If you notice, Maku has disappeared into the background. Starting to throw a little bit of a fit there, so we give him a break. And now I have my daughter trying to creep in to the podcast here as well. So yes, not only are we working from home, but we've got families here with us. So carrying on, we just covered the dry kibble. So let's talk about canned and wet food. What are some pros and cons to those?
Pro is going to be, it's going to be a little bit more palatable, which means that it's going to be more appealing because the aroma is going to come off it more easily. Something where you can heat it up as well. It's going to make it more palatable. So that's a big one. Something to note between dry kibble and wet food. There's a lot of questions that come up about hydration and hydration status. There's limited evidence that's been shown in studies that suggests that dry kibble or wet food results in a higher hydration level for either pet. And the best way to compare that for humans is think about it when you're eating a salty food like a pretzels. Pretzels don't make you dehydrated. It makes you want to drink water. So if you eat something salty, then you drink fluid along with it. So what they've found is that in the limited studies they've done with cats specifically, cats with kidney disease, because it's really important to keep them hydrated, that cats that eat dry food will drink more water to compensate for the dry food that they have on board. Cats that eat wet food will drink less water because they're already maintaining that hydration with the wet food. So there's not a big difference in terms of hydration between wet food and dry food. So it doesn't hurt to go for the wet food to try to encourage that, but it doesn't necessarily help from the good empirical data that we have so far. One of the downsides for canned food is going to be the weight, the storage. So if you're storing an equivalent amount of wet food as you are dry food, you've got the can weight, and then you've also got the weight of all that water that's in there. That's going to increase the difficulty to store. It's harder to go get a month's worth of canned food or bring it with you on a trip than it would be to bring a month's worth of dry food, for the same reason it would be for a person. Second part is going to be cost. Canned food typically is more expensive because you have to do more to it to keep it shelf stable. It's got to be well sealed because that moisture will allow bacteria to grow. So because those shipping costs are higher, because it's heavier, because it requires the cans, because it has to be vacuum sealed, that all increases the cost. And then part of it's just that you're paying for water when it comes down to it. That additional fluid inside the can is going to add to the volume and to the mass. And if you're paying for an equivalent weight of wet food and dry food, that wet food is going to be a lot of water content. One of the other myths that has come up has been that, and this is something that I've said for many years, is that wet food will promote dental disease more than dry food will. They've done studies, they've shown that they can't really find a correlation. It still makes sense in my head that the wet food's going to glom onto the teeth. And so I'll probably die on that hill. I'll probably hang on to that misconception for a little bit longer. But realistically, wet food and dry food contribute the same amount to dental disease.
Is there ever a situation where the pet would just needs to have canned food or wet food?
Yeah. So going back to dental disease, dogs without teeth can typically still pull that kibble in and chew it, but dogs with painful mouths or dogs with tumors in their mouths or damage to their jaw structure, they're going to benefit from that wet food because it's going to be easier for them to take in. And so sometimes you'll see it with pets with any of those conditions. Also, pets that are getting into their senior age or are sick for other reasons that increase palatability can encourage them to eat when it otherwise wouldn't. So for you and me, if you're not feeling well right now, so maybe chicken and broccoli and rice isn't as appealing to you right now, but if someone swung by with big cheeseburger, you might be willing to fight through not feeling as well to get that cheeseburger down. So in that same way, having something that's more palatable, more aromatic for dogs, rather their tried and true is going to be encouraging to eat.
Yeah. So I'll be watching my front door for that cheeseburger to show up. Don't worry. All right. Let's talk raw diets now. Commercial and home prepared. What do you got for there?
So raw diets is a controversial one, and for good reason. Where to start with it? There's no real pros to raw diets. The only one that you can maybe see would be if there's really high quality ingredient. You could argue that one, but the problem with a raw diet versus a commercial diet versus any other diet is that you have, it all comes down to the nutrients that are going into your dog's body. There's going to be bad raw diets and good raw diets just in terms of a nutrient profile. So one of the problems that we can have with that is that you have the raw diets tend to be more driven by smaller companies, by more kind of homemade mom and pop shops, which is great in a certain respect. But there's problems with that too in the form of quality control. So you can have a diet that shifts slowly over time. One ingredient starts to take over more than others. Maybe it's not fully balanced. There's not somebody double checking to make sure that it's nutritionally sound, because people have a tough enough time keeping their own nutrition as a human correct. And that's with all of the indicators we have for ourselves, all the signals our bodies send, all the things that we know for ourselves. And now you're taking that and applying it to a different species, and then you're feeding them basically the same thing every day which I forgot to touch on before, but is another big reason why diet is so important, is that if they're getting pretty much the same thing every day or something very similar every day, and there's a nutrient imbalance or a calorie overage or calorie underage, it's going to amplify over time. Because if they just get a couple extra calories every day over the course of 5 years, they're going to get fat. If they are deficient in a certain micronutrient just a little bit every day, and they're getting that over the course of 5 years, they're going to develop disease. So it's not something where they necessarily have the opportunity to self-correct. But back to raw diets. So on a purely nutritional standpoint, there are good raw diets, there are bad raw diets. Why I don't like raw diets? Ultimately, if you are handling a raw diet and you're doing it at your home and you're doing it in your kitchen, people are not sanitary enough. They used to do these eyewitness reports in special investigations back in the 90s, where the local news station would go out and they would test people's kitchens and compare them against commercial kitchens, and every single one of them would get a failing grade because we just aren't hygienic enough. We don't think about it often enough. We'll cross-contaminate, we'll cut the chicken and then we'll cut some salad with that same knife, or we'll use the same chopping block, or one of these things will happen. So on human food, we're not clean enough. Now you're taking a bunch of raw food and you're giving that to your dog. So first off is the hygiene problem. It promotes disease. If you have a cat that is going in a litter box, their stomach doesn't kill all the bacteria that's inside that food. Bacteria will pass through, salmonella, other organisms will pass through into their poop. They stand in the litter box, they move that poop around with their paws. And if you're not really strict about it, then they're jumping up on your countertops, and they're walking around in your counter, and they're spreading salmonella all over the place. So I had someone very close to me who I won't name, who I refused to eat at their house after the first couple visits because they fed their cats raw diets, and their cats were allowed to walk on the countertops. And so I said, all of your food is contaminated. Everything is here is contaminated. I'm only eating out while I'm staying with you, and I'm not eating on your counter. Last problem with raw diets, they've actually been shown in studies to promote antibiotic resistance. So most likely what's happening is the antibiotics that are being given to the prey animals, so to the cows, to the chicken, the way that they're raised is promoting bacteria that is resistant to that antibiotic. And that's something that we can definitely dive into on a separate episode a little bit deeper. So then in the preparation process, that bacteria is not killed off by heat, by all the things that we do to reduce contamination in food and make it safe before it gets to you. And then they're eating that with that bacteria still in there. And now it's populating their gut. And now they're spreading that resistance. So tons of problems with raw diets. I'll get off my soapbox here for a second and let you talk.
So what you're saying is raw diets are the best diets.
I'm saying they're so good. I'm saying that's what your dog's ancestor ate, is raw meat. So your dog should eat raw meat, just like your car's ancestor ran on diesel or crude petroleum. So you should put diesel fuel into your Kia, is what I'm saying. Because it's equal logic. It makes sense.
But my Chihuahua is a descendant of the wolf.
Yeah, your Chihuahua is exactly like a wolf, and it hunts in packs, and it does all the same things.
Could you imagine? That'd be terrifying. You go out into the wild and just tons of Chihuahuas. I'd be so much more scared than wolves. So now we know how you really feel about the raw diets. However, we have clients that come in pretty regularly, and this is not your typical speech you give them, right? So how would you approach that topic when the client comes in and they're asking, hey, what do you think about the raw diet?
Yeah, you all are getting the raw, unfiltered Dr. Mosites today. I don't normally come in this hot when a client brings it in, because I want them to feel welcomed. I want them to be open to suggestion over time if I make them. I don't want to make them feel bad for coming in and seeing me, because that's how we lose people. And so if they are making what is ultimately what they feel is a really good decision for their pet, I don't want to ostracize them for it. I don't want to make them feel alienated for it. So usually the biggest thing I'll talk about is the hygiene. Now that information has come out about bacterial resistance, I'll probably start bringing that up as well, that it puts all of us at risk and is going to make ultimately medicine more expensive, because when we can't use older antibiotics, we have to use the newer ones that cost more and have other risk profiles with them. So those are probably the two biggest things that I bring up, especially if they've got kids in the house or anybody who's immunocompromised. I would really discourage it for cats, or I would try to push them towards, if they're going to use raw, to use a pasteurized commercial raw diet. It doesn't kill off all the bacteria. It's the same way that pasteurized milk can still go bad and spoil. these foods still have bacteria in them, but it reduces the quantity and reduces the amount. So it's at least one step we can take towards making it a little safer.
Very nice. Very nice. So let's shift away from the raw diets. Let's talk about subscription diets, like the fresh, the frozen, like the human grade style shipped diets. What do you think about that?
Surprisingly, I'm pretty open to it. It's a very popular trend right now. People are very into it. There's a lot of misinformation surrounding it and a lot of claims that are being made that are unsubstantiated that help people to feel good about spending the money, but don't necessarily result in better outcomes for their pet. And again, the reason for that comes down to the nutrient profile. If you are getting a certain amount of protein, a certain amount of carbs, a certain amount of fat in your diet, your body sees it all the same. It breaks it down all to the same level. So it doesn't necessarily care as much what form it comes in. Rations in the future that are completely nutritionally balanced, they may not be the most appealing as a burger would be, but it might be healthier for you. So in this case, definitely check to see that it is been monitored by some of the organizations that we'll talk about here in a little bit that show that it's a healthy, balanced diet. Some of the upsides to it are palatability. So if you're using fresh ingredients, there's a good chance your dog's going to like it more. Downsides, honestly, the biggest one's just the cost. And I see that selfishly from a health perspective, where if you've got a dog that's getting a $300 a month food subscription and then has a medical issue, that food isn't going to make that medical issue go away. And that owner is going to be put in a tight spot because they can't afford surgery. They can't afford medications. They can't afford long-term things like insulin. So cost is the biggest thing that makes me worry. It's the reason, honestly, why I don't do it for my guys as well. The other problem that we can see is going to be how shelf stable some of them are, that as they're sitting in the fridge, same thing as with the raw diets. I have a bad habit for myself. I get excited about eating veggies and I buy a bunch and they go bad in the fridge, or they lose some of their content in the fridge over time. And that's going to happen too for some of these shipped fresh ingredients, is they're going to destabilize over time, and they're not going to have that nutrient profile we want because it's breaking down, because that's what happens.
Absolutely. So you mentioned earlier that the subscription diets are kind of a big trend right now, right? So with that, of course, everyone's going to try to get their foot in the door, and you're going to have some great companies doing, and maybe some companies that are a little less great. Do you have any brands that you recommend to stick with or stay away from?
Sure. I'll go out on a limb here. I'll say Farmer's Dog has tried to make inroads with the veterinary community and show that their product has been vetted, that it has been confirmed to have the content that it has. I still have problems with some of the marketing claims that they make, but as far as if I'm recommending a particular brand or a particular diet to a client, I'll go for that one. But I think realistically that there's enough brands out there that I don't think it's the only one that's good. It's just the one that I'm the most familiar with and the most comfortable with as a result of exposure. So I'll say a weak recommendation, Farmer's Dog.
Okay.
Or I was bought, it's not Big Kibble anymore. It's Big Fresh Pet.
That's it. All right, let's move on to the next category then. The next up I have for you are the grain-free diets. Can you tell me a little bit more about grain-free diets and also DCM?
So quick editor's note, we just had to take out quite a bit of a rant by me on grain-free diets that involved a number of curse words as well. So welcome back, everybody who didn't have to listen to that. And sorry, Tim. Grain-free diets, I am also not a fan of. Initially, the problem that I had with them is kind of the same issue that I saw with those fresh diets, is that it seemed more like a marketing opportunity for pet food companies to come in and say, well, people know about celiac disease in humans, and grain-free and gluten-free is a big deal and a big trend in human food right now that people are pushing towards. People want to do the best for their pets. People use what they know to do the best for their pets. So people are more likely in that case to buy grain-free or gluten-free diets for their dogs. The problem is that there's never been a diagnosed case, to my knowledge, of celiac disease in a dog. And if there has been one, it's been very recently, and it's on the country.
That's because the grain-free's kept them from it.
No, it's because Big Kibble's keeping them from it. So that was my problem initially, was that it just seemed like a marketing ploy where there was no realistic benefit to it. And if anything, it was just another expense that wasn't necessary. That was just a marketing scheme that in many cases was using less expensive ingredients to substitute for the previous ingredients and make a food. The real problem, though, came a couple years in, where it went from being Well, I mean, there's no real logical sound reason for it to it's actually causing harm. And that was in a study done, I believe in 2018, where they showed that eating a grain-free diet consistently resulted in a higher rate of dilated cardiomyopathy. So resulted in a higher rate of heart disease for dogs. From my remembrance of it was that it was lacking in taurine. There wasn't a high enough taurine content, which is an amino acid that's found in many of those grains that they were using, that the substitutes that they were using for those grains didn't have as high of a content. Not to say that you can't make a grain-free diet that compensates for that, but at least they weren't at the time, and they weren't pulling the diets off the shelves that were implicated in this study, which was really upsetting to me. And because if you've got a company that claims to be in pets' best interests, and you've got this food that there was no reason to ever make, that now we're saying it might cause problems, why wouldn't you pull it, or at least find a way to reformulate it so that you can rule that out, or even just add another source of taurine in there, right?
Yeah, you could definitely pour a little bit of a Monster energy drink over the top that has taurine.
Exactly. Don't feed your dogs Monster either. So grain-free diets are a bee in my bonnet. I don't like them. I don't see a reason for them. I still have difficulty sometimes convincing clients not to use them because the marketing has been so effective. And because people, again, want to do what's best for their dogs, and they use what they know.
So then if you were trying to steer them away from grain-free, what would you do at Mermaid Vet? What would you recommend instead?
If there's a grain-free diet that they're on, that they could be on a slightly better one, I'll try to steer them in that direction. And I can't remember the details of the ones that I normally recommend right now, but like I mentioned, there are formulations that you can find that are less likely to have that problem if I absolutely can't get them off of it. Otherwise, every patient, every client, I'll explain the studies. I'll try to get them links if they're willing and wanting to read those studies. And I'll talk about celiac disease and gluten grain intolerance in dogs. We'll talk about that they're ancestrally omnivores, so they're scavengers, basically. That's the reason why they became man's best friend, is that they used to eat our trash. So they eat what we eat, basically, and that includes grains and a variety of other things that we eat as well. The other thing that I'll recommend, if we're really determined, is I'll say, well, if we believe your pet needs to be on a grain-free diet, let's at least prove it first. Now, the downside there is that diagnostically to get there, it's pretty expensive, and really to definitively diagnose celiac disease, you need a full thickness biopsy of the intestine. So you need to go in abdominally, either with a scope or surgically, and get a sample. So it's really invasive. So it has to be a dog that's got major issues to want to go down that pathway. And usually we find something else that's the cause for it first, and usually we find a solution for it before we ever have to go that far. So that's what gives me confidence that there's just not much to these diets.
All right, now that we've talked a lot about the trending diets and such of those, let's talk about the medical diets, prescription and veterinary therapeutic diets. Let's start right into there. When are they actually needed, and why are they more expensive?
So prescription diet is going to come up when a veterinarian recommends it. So there are certain conditions that can benefit from having a different type of diet. There are diets that can help with joint disease. There are diets that can help with liver disease, with heart disease, kidney disease, although that one is a little bit less certain now. We talked about one of our YouTube videos about obesity being treated by a specialized diet that has a lower calorie content and a higher nutrient profile. So you're able to cut calories without cutting the nutrition that your dog needs. So those would be the cases where they're actually needed, but it's always under the guidance of a veterinarian, and there's always a very specific reason for it.
Can you list a few more of the situations where the conditions that the pet will be benefited from a prescription diet?
Sure. I mean, like one that comes up that we can't really do another way is going to be allergies. So if you're going through a food trial, there are ways to do it without a prescription diet, but a prescription diet is the sort of most straightforward approach.
And what do you say to the pet owners that when you start to pitch them on the prescription diets, they say, isn't this just expensive food?
Well, it is expensive food, and that sucks, and I'm sorry. I always feel bad for any large breed dog that has any disease that requires a specialized diet, especially allergies. That's the most common one we see. And allergy food is expensive, but sometimes it's necessary. But realistically, the reason why it's more expensive is because it either has to be made in a specialized way, it is got a specific nutrient profile that requires it to be developed separately, and then the research and development to make sure that it's actually doing the job that it needs to do. These studies tend to cost in the millions of dollars, which is, I wish there was a better way to get stuff through in America specifically, but this is the system that we have. And so it costs a lot of money to get studies done on animals, on anyone, to prove that these diets do what they're supposed to do. And those companies want to, and realistically probably should, recoup some of those costs that show that this diet really does do this specific thing. One of the ones I haven't mentioned yet that we'll talk about this with is going to be urinary crystals. There are diets that are prescription that are specific to preventing urinary crystals and stopping urinary stones in dogs and cats. One of the things I'll tell clients is that doesn't mean the food that they're giving them isn't a bad food. It's just bad for that pet. It might be great for another pet, but it's bad for their pet. And there might be a food that is good for their pet that is not prescription. The problem is that, do we want to spend the next 2 to 3 years trying out 10 to 12 foods and their pets at risk the whole time for stone formation? Probably not. So that's where prescription diets come in.
All right. Let's see. Well, yeah, thank you for all the useful information you provided, Dr. Mosites. We're going to make this into probably a 3-part session. We've got a lot more to cover in diets. This is a very large topic, but as I've got my sick kid in the other room hollering for me, and you've got your baby right there hollering for you, let's call it quits on this one.
We'll see y'all next time.
All right.